Hola mi gente, I am Silvia Salazar from Tono Latino. I'm going to give you 6 important facts about coronavirus and the resources that you can use to check the information for yourselves after I publish this video. Hopefully that way you'll feel not only better informed, but prepared so you can share this with other people and hopefully calm down the panic and slow down the spread of this disease. Point number 1. The virus is spreading very, very fast. As you can see on this chart, the majority of the cases are still in China. But while the number of new cases in China is slowing down, it is going up in the rest of the world. So we have to look at something else, the growth rate. How fast are cases doubling in some places around the world? Let's take into account Italy. Italy pretty much shut down their entire government. The confirmed cases have doubled in the last 4 days, from 4,636 cases on March 6th to 10,149 cases on March 10th. Now, what is going here in the US? Confirmed cases have doubled in the last 2 days, from 213 cases on March 8th to 696 cases on March 10th. But we're also here in the US not testing enough people. And I'm going to get to that a little bit more on point number 6. Point number 2, know the symptoms of coronavirus. The symptoms of coronavirus are going to vary from patient to patient. But in most cases, we see fever, dry cough, fatigue, and a thick mucus that you cough up from your respiratory tract. So if you have fever and a dry cough, it is important that you immediately call your doctor. Point number 3 brings us a little bit of positivity. The death rates in China, which is the country with the most amount of cases, has been going down over time. In the province in China that was hardest hit by this disease, the death rate went down as clinicians learned how to identify the virus and how to treat it. But something else is super important. China took extremely drastic measures to lock down affected areas and prevent the spread of the disease so that it wouldn't overwhelm the healthcare system. Today, as of March 12th, we have over 127,000 cases, confirmed cases worldwide, with about 4,700 deaths, but over 68,000 people have recovered. This is really, really good news and continues to reinforce the need to slow down the spread of the disease. Point number 4. This is much more severe than the ordinary flu. It doesn't matter what El Presidente is telling everybody. He is not a medical expert, and the numbers do not lie. So even though a lot of people could have coronavirus and, like the flu, have mild symptoms, it can be very dangerous and lethal, especially amongst elderly and vulnerable populations. I mean, about 6% of people over 60 or older that are infected with coronavirus die from this disease. According to the data we have so far, that is over 6 times more deadly for the elderly than the ordinary flu. And you know what else? Experts also think that the coronavirus or COVID-19 is more contagious than the ordinary flu. Point number 5, this is something that I referenced back in point number 1. The United States is not testing enough people. We are a country with over 327 million people, and we're only testing about 23 individuals out of every million. Let me say that again. 23 people tested for every million people in this country. South Korea has been testing 10,000 people per day since late February. 10,000 people per day. As of March 11th, we have tested a total of 7,695 individuals. That is less than what South Korea does in 1 day. If you want to continue checking this data, I've included a link in the description of the video below. That brings us to point number 6. Why is everything getting canceled and self-quarantine is so important? And this is a great way to summarize some of the points I made earlier. It's highly contagious, It's dangerous for elderly people and vulnerable populations, and we're not testing enough individuals. Well, NPR put this in a really clear way for everybody to understand. Imagine rush hour. Everybody wants to get into the subway at once. Well, the trains cannot handle hundreds of thousands of people all at the same time, so you have to do it in batches. Otherwise, if everybody tries to get into the same train at the same time, the system becomes overwhelmed. But you can actually spread out the way to transport these people if you do it over time. This is kind of like the same strategy we should look at right here. That is going to help ease the burden on the healthcare system and improve the odds for people that are sick. I want to give you a bonus tip. If you have any kind of medication that you need to take and you should not discontinue, maybe talk to your doctors and see if it's possible to get a prescription refilled for a couple months so that you have enough inventory at home. Give me a thumbs up in the comments if you found this information useful, and don't forget to check the links that I put in the description so you can continue monitoring this information that I gave you. Also, feel free to ask me any questions about this content or any ideas that you would like me to research and prepare in future videos.